Hi, my name is Brittany Seal. This is my presentation on HIV and pregnancy. HIV is a retrovirus that attacks the cells of the immune system, leading to a loss of immune function and often the development of acquired immunodeficiency syndrome, also known as AIDS. The virus specifically attacks the body's CD4 cells, which are white blood cells that are utilized to fight infection. Symptoms typically appear 3 to 4 weeks after exposure, but in some individuals they don't show at all. The symptoms typically mimic signs of the flu, including a sore throat, fever, night sweat, chills. These symptoms go away on their own within a week or two and may not show signs again of the infection for years. HIV is a very slow developing virus that, is left untreated, can take 5 to 10 years to fully develop. The virus is chronic and has a potential for being fatal. The fatality risk increases if a person is left untreated with high viral loads and a low CD4 count. This typically occurs when the virus progresses into AIDS. Epidemiology of HIV infection. The epidemiology of HIV infection in the United States has changed significantly from the early 1980s, when it began as an epidemic predominantly affecting young, white, middle-class men who had sex with other men. The epidemiology of the disease today has great diversity. The disease can affect all sexes, ages, races, and sexualities. The estimated incidence of HIV in the United States was 56,300 new infections in 2006. The overall HIV prevalence in the United States cannot be measured directly because an estimated 21% of persons infected with HIV have not been diagnosed. The most common mode of transmission for HIV in the United States is through unprotected sexual intercourse. Maternal, perinatal, and fetal risk. Maternal and perinatal risk. Pregnant women who are HIV positive can have a very normal pregnancy if they follow the treatment regimen. However, if they have a low CD4 cell count, then they may be at a high risk for infection. During pregnancy, they may get frequent UTIs. During delivery and post-delivery, they may be more susceptible to infections or slow-healing wounds. Drugs can be given during labor or prior to a cesarean section to prevent any development of infection. For fetal risk, the virus can pass to the fetus through the placenta, amniotic fluid, or through delivery. This exposure can result in the fetus becoming infected and ill from the HIV virus. It is recommended by the CDC that HIV-positive women deliver vaginally and that you wait to rupture the amniotic sac to prevent early exposure. Patient presentation. Subjective. A patient may complain of fatigue or extreme exhaustion because of their poor health conditions. Patient may complain of infection symptoms such as a sore throat, fever, chills, and night sweats. In pregnancy, UTIs may become very recurring, so the patient may complain of urgency, frequency, or burning with urination. Objective. The patient may present with weight loss. Patient's skin may have rashes or cancerous lesions from Kaposi sarcoma. Patient may have an unsteady gait from weakness. Patient may have visual or hearing changes. Lab values may indicate an elevated white blood cell count or high viral loads, and a urine dip may be positive for nitrites, indicating an UTI infection. Differentials. Cancer affecting the immune system, such as leukemia, could have similar symptoms as HIV. Leukemia causes abnormal white blood cells that have a difficult time fighting off infections, which leaves the patient immunocompromised. Another differential diagnosis could be viral hepatitis, which causes similar symptoms as well. This disease affects multiple organs and body systems. It does not attack the immune system of the individual, leaving them weak and susceptible to infections. Diagnosis. HIV can be diagnosed by a blood test detecting antibodies or viral loads, or saliva tests. A high-risk individual, such as an IV drug user, a person who performs risky sexual acts, or a person with multiple unprotected sex partners, should be tested every 6 to 12 months. Diagnostic options include the ELISA test, which is an enzyme-linked immunosorbent assay used to detect HIV antibodies in the blood. If the result is positive, it must be confirmed with a Western blot test. A Western blot test is a sensitive test that identifies HIV antibodies in the blood. A viral load can also detect the viral load in the blood and diagnose HIV. It's typically used for early detection of the virus or to assess how treatment is working on the patient. A saliva test can also be collected and placed in a vial. It's assessed in the lab for presence of HIV antibodies. This test is really reliable. It's usually 91% accurate. Treatment. There are dozens of treatments to treat HIV infection. These drugs are known as antiretrovirals. Due to frequent mutation of the virus, the patient may become resistant to one medication, so they may need to switch medications frequently or use multiple drug regimen to avoid drug resistance. It is important for these individuals to eat a healthy, well-balanced diet and perform a regular exercise regimen to improve their health and boost their stamina. Patient education should include proper hand hygiene, avoiding individuals who are sick, notifying your provider at first signs of infection, taking medication daily as prescribed, do not stop medication abruptly, do not share needles, use protection when engaging in sexual intercourse, notify a partner prior to sex of HIV status. During pregnancy, follow your provider's recommendations on drug therapy and lab follow-ups. Viral loads and CD4 counts will be monitored frequently throughout the pregnancy. The goal is to have an undetected viral load. Frequent NSTs will be done as the pregnancy progresses to monitor fetal well-being. After delivery, babies who are born to HIV-positive mothers are tested for HIV several times in the first few months. The test looks for a presence of HIV in the blood. 2 positive results indicates an infection with HIV. At 12 to 18 months of age, another HIV test is performed to rule out infection of the virus finally. After delivery, within 6 to 12 hours, it's important for the baby to get treated prophylactically with antiretrovirals. And here are my references.